What is medical ventilator? A medical ventilator is a machine that helps your lungs work. A ventilator helps to push air in and out of your lungs so your body can get the oxygen it needs. You may wear a fitted mask to help get oxygen from the ventilator into your lungs. Or, if your condition is more serious, a breathing tube may be inserted down your throat to supply your lungs with oxygen. A doctor or a respiratory therapist will control how much oxygen is pushed into your lungs by the ventilator. A ventilator can help you get the oxygen you need for your organs to function. Many types of health conditions can cause you to have difficulty breathing, such as ventilators have also been used on some patients diagnosed with COVID-19. Mechanical ventilation is only for the most severe cases where the lungs are filled with fluid, making breathing difficult. If you have general anesthesia for a surgical procedure, you may need to be on a ventilator while you're asleep. This is because some anesthesia drugs can make it difficult for you to breathe properly on your own while you're in a sleep-like state. With surgery, you may need to be on a ventilator for a period of time as follows. The length of time you'll be on a ventilator depends on the reason you need help breathing. If you need a ventilator during surgery, you'll typically only be on a ventilator while you're in a sleep-like state. If you need a ventilator for a health condition, you may need to be on it for hours, days, weeks or longer. It depends on how long it takes for your lungs to get stronger and to be able to function properly on their own. The job of a ventilator is to keep you breathing while your body fights off an infection or illness or recovers from an injury. A medical ventilator uses pressure to blow oxygenated air into your airways and to remove carbon dioxide from your body. Oxygen from a ventilator may be pushed into your lungs in one of two ways, with a fitted mask or with a breathing tube. The use of a face mask to get oxygen into your lungs is known as non-invasive ventilation. A tube will be connected from the face mask to the ventilator, which will push air into your lungs. For more severe cases, you'll need a breathing tube inserted into your throat and down your windpipe. The breathing tube that's inserted into your windpipe is connected to a ventilator that forces air into your airways so your body will be able to get the oxygen it needs while you heal from your illness or injury. If you're on a ventilator for an extended period of time, you may need a tracheostomy. A tube will be inserted into your trachea, below your vocal cords, and then connected to a ventilator. A tracheostomy may also be used to help wean you off a ventilator if you've been on it for a long time. You can't talk, eat, or move around while you're connected to the ventilator. If you're on a ventilator with a face mask, you will likely be able to talk, swallow, and cough. Your doctor may give you medications that help you feel more relaxed and comfortable while you're on a ventilator. This helps make being on a ventilator less traumatic. You'll no longer need medication once you are done using the ventilator. If you're on a ventilator, you will likely need other medical equipment that monitors how you're doing overall. This is more common if you're on a ventilator for a longer period of time. Some of the most common risks associated with being on a ventilator include: you may find that you have a sore throat or aching, weak chest muscles when you're taken off the ventilator. This can happen because the muscles around your chest get weaker while the ventilator is doing the work of breathing for you. The medications you receive while on the ventilator may also contribute to your weak arm muscles. This means you won't be completely taken off the ventilator. Instead, you'll be taken off it gradually until your lungs are strong enough to breathe on their own without any help from the ventilator. If you've been on a ventilator for an extended period of time, many of the muscles in your body will be a lot weaker than they used to be. Ventilators are breathing machines that help keep your lungs working. But they can do the breathing work for you while you're being treated or recovering from an illness or health condition. Ventilators can be life-saving and an important part of treatment support for people of all ages, including children and babies. How long you're on a ventilator depends on how long you need help breathing or how long it takes for your underlying condition to be treated. Some people may need a ventilator for only a few hours or less. You, your doctor, and your family can work together to decide whether using a ventilator is best for you and your health. A ventilator can help save the lives of some people with COVID-19 by supporting their lungs until their bodies can fight off the virus.